This is how you administer an intradermal injection. So first, you would verify your healthcare provider's orders and then prepare the injection for one patient at a time using an aseptic technique. Make sure you check the label of the medication with the medical record. And then you would take the medication to the patient at the correct time. Make sure you apply the 6 rites of medication administration. You would gather all of your necessary equipment and supplies, and then when you're preparing an injection away from the patient's bedside, make sure you label the syringe properly. You would then provide patient privacy by closing the curtain. You would perform hand hygiene, and you would put on gloves. You would introduce yourself to the patient and the family, and then you would identify your patient using 2 patient identifiers, their name and date of birth. If they're nonverbal, it would be their name and the medical record number. At the patient's bedside, you should then compare the medication you're about to administer with the medical record. Make sure that the names of the medications are correct and they have the patient's name on them as well. You would then explain the procedure to the patient and ensure that they understand what's going to happen. Discuss the purpose of an intradermal injection, its action, and the possible adverse effects of it. Allow your patient to ask you questions, and tell your patient that the injection will cause a slight burning or stinging sensation. And tell your patient to report any itching or shortness of breath, which could indicate a reaction. You would then raise the bed to a comfortable working height. You would keep a sheet or gown draped over portions of the body that did not require exposure. You would select an appropriate site and note any lesions or discoloration on the skin. You would help the patient into a comfortable position. For allergy and tuberculosis tests, have the patient extend their elbow and then support the elbow and the forearm on a flat surface. For flu vaccine, have the patient relax their entire arm. You would apply clean gloves, clean the site with an antiseptic wipe, allowing it to dry. You would hold a swab or a piece of gauze between the 3rd and 4th fingers of your non-dominant hand. You would remove the needle cap from the needle, hold the syringe between the thumb and forefinger of the dominant hand with the bevel of the needle pointing up. To administer the injection, use your non-dominant hand to stretch the skin over the site with the forefinger or a thumb. With the needle almost against the patient's skin and the bevel of the needle facing upward, insert the needle slowly at a 5 to 15 degree angle until you feel resistance. You would then advance the needle through the epidermis to a depth of 3 millimeters beneath the skin. Intradermal flu vaccine, if the injection was performed with an intradermal microneedle, insert the needle perpendicular to the skin. You would inject the medication slowly and observe for a small little bubble. You would then withdraw the needle and apply an alcohol swab or a gauze pad gently to the site to control bleeding. For a tuberculosis test, if the test was repeated, attempted administration at least 5 centimeters from the original site or use an appropriate alternative location. You would then help your patient into a comfortable position, remove your gloves, and then perform hand hygiene. You would stay with the patient for several minutes to watch for any allergic reactions. You would then place everything in reach, including the call bell. You would raise the appropriate number of side rails and lower the bed to the lowest position for patient protection. You would document and report the patient's response and their expected outcomes.